Chair.
Go ahead, Mr. Johns.
Yeah, thanks. This gets right to the question that I want to ask, Minister. And you've heard me say this before, that, disinformation in a health crisis costs lives. Incrementalism in a health crisis costs lives. So, Minister, do you actually believe the funding allotted to address the substance use toxic drug crisis at the federal level is commensurate with the scale and scope of the toxic drug crisis taking place right now in this country?
I would say that since 2016, this government has ensured that over $1 billion has gone in towards addressing the toxic drug supply, which is substantially more than the previous government that had only allocated at the start of its tenure $30 million to treatment and reduced that by 2/3 by the time they exited their governing term. So from 30 million down to 10 million, this government has put in $1 billion in addition to the $25 billion that is part of the $200 billion that is going towards healthcare today. So I would hardly say that we've taken our foot off the gas, and I would reject that premise.
Well, I would reject that answer, because I'll say this, Minister, you've spent less than 1% of what you spent, your government, in terms of responding to the COVID-19 crisis. And if you want to compare yourself to the Harper government, go right ahead. But we know they didn't take this issue seriously. So, Minister, I'm going to